Again, I'd like to say thank you to everyone for being here. And hello, Florida, and thank you for signing on. My name is Ingrid Collins. I'm the AARP Florida Associate State Director for Outreach in Central Florida, and I want to welcome you to this AARP session. Today, we're going to be talking about policymaking decisions that affect Floridians age 50 plus, and we're going to break down key bills from the 2020 Florida legislative session. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people age 50 plus to choose how they live as they age. AARP does not endorse candidates for public office or make contributions to either political campaigns or candidates. And today, my good friend and colleague, Zane Smith, is here with us today to discuss Florida's 2020 legislative session. Hi, Zane.
Hey, Ingrid, thank you. So I'm Zane Smith, an Associate State Director of Advocacy here at the Florida State Office. And it's great to be here to talk about some of the bills that passed. And it may seem like quite a long time ago, but the legislative session actually ended on March 19th this year. Little fun fact, Florida is the only state that completed a full legislative session. There were many other states that had started a session or were getting ready to go into session, but were unable to complete it. So we are in a very unique position to talk about policy bills unrelated to COVID that Florida actually addressed before everything hit. With that in mind, there were actually 207 bills that passed the legislative session, and we're just going to talk about a handful, specifically those that address some of the most pressing issues for the 50 plus population here in Florida. Some of those issues will include guardianship, long-term care, nursing homes, broadband internet, a budget that was, for once, a very stellar budget in terms of how it impacts the 50 plus. So I look forward to our discussion today.
That's fantastic, and a very hefty list, Zane. So let's get started. Certainly, probably on the minds of many of us Floridians is COVID and how it has affected nursing homes. And although it's not directly related to the actions of the state legislature, the governor's office has made some temporary rules since the pandemic started. So can you tell us about those issues and what are we seeing in the nursing homes?
Sure. So just to reiterate what you made a great point is that this has nothing to do with the legislative session when we're talking about these few issues as it relates to COVID and nursing homes. And AARP has been on the forefront of some of the biggest fights to protect residents in Florida nursing homes amid the COVID scare. I'm going to just highlight three of the bigger ones that you may have heard of and I think are the most pressing. So the first one, if you recall, when this hit early on, there was a lot of information and news coming out about nursing homes were specifically hard hit by COVID infections and deaths, whether it be the residents or the staff. Well, the state of Florida was rather reluctant to release the names of those nursing homes that had positive tests or deaths. So AARP, with the help of our advocacy leader, Jack McCrae, our national office attorneys and policy experts, drafted a legal memo to talk about how HIPAA, so the privacy rights related to healthcare, did or did not apply to the state releasing the names of the nursing homes. If you recall, the governor's office and the agencies used HIPAA as a reason they didn't release the names. We had a counter legal opinion, so we drafted this memo, sent it to the governor's office and to the state agencies, and 2 days later, they announced the names of the nursing homes that had infections while still protecting the privacy rights of the residents. So they were not named, individual residents or staff were not named, but just the nursing homes. So that way loved ones knew where these infections were occurring and if they had a loved one in one of the facilities. A second big issue that AARP has been advocating for is the retiree workforce during this global pandemic. One of the issues that we're seeing is healthcare facilities struggling in terms of staff, whether the staff is falling ill, there's not enough staff to maintain the high level of infections and admissions into the hospital. So one thing AARP nationally and here in Florida pressed for is creating ways in which retired healthcare workforce employees could come back to work on a temporary basis to help relieve some of this stress on the current workforce. We set up a suggested guideline, submitted it to our state surgeon general, Scott Rivkees, And they actually use some of the blueprint which we provided for them to initiate some temporary licensing for healthcare workers to come back in. One final issue that has come up and is becoming more of an issue now than when the pandemic originally hit was the issue of discrimination and healthcare disparities. One thing AARP prides itself on is that it fights for everyone, regardless of age or disability. And that's something we also use in our advocacy related to the COVID pandemic. We issued letters and guidance to the state to help alleviate any kind of discriminatory practices that would prevent people because they're older or because they have some sort of disability from receiving testing and or healthcare during this pandemic and moving forward. So those are three things we fought for related to COVID that we really take pride in and think that has really helped some of our most vulnerable residents here in Florida.
Absolutely. And we encourage everyone who's on this call today that if you want to hear more about the issues and the policies and the things that AARP has done and continues to do for all of us during this pandemic, please visit aarp.org/coronavirus. That's aarp.org/coronavirus. You'll find lots of information and an extensive list of resources there as well. So Zane, thank you so much for that update. And so let's switch back now to the legislative session. And because from what I understand, the governor hasn't signed many bills. And we've been getting questions about, releasing our own update, but here we are, and many bills are not signed. And the session, of course, ended with COVID-19, so we understand that there was a lot going on. So just tell us what happens now to those bills that they passed, but they're not signed. What happens next?
Yeah, great question, Ingrid. And that's exactly where we are with all the bills that we're going to discuss today, is that they, in fact, pass during the legislative session, but remain unsigned by the governor. This is kind of an unprecedented time. The governor's attention was obviously focused on the pandemic. Emergency response continues to be on a very large level. And so it's understandable that these bills have not been signed. Right. We are in a kind of a hold pattern, and we hope that this will change soon. Right now, the legislature will have to present the bills to the governor. Once they are presented to the governor, he will have 15 days to take action to whether he signed them into law or veto them. We're hopeful, based on DeSantis's track record of being quick to sign bills, that once they are presented by the legislature, he will sign the bills in a rather fast manner. And so most of these issues will become law once his signature is on the bill. Okay, so yeah, so hopefully things will start to move here soon, and then the legislature will present the remaining bills to our governor. And so on that note, we know that the legislature passed a $93.2 billion budget, which so far remains unsigned. So can you tell us how older residents fared in that budget? Yeah, like I mentioned earlier, this year's budget really was a great victory for older residents on multiple levels. And interestingly enough, what's normally a very highly charged, days-long debate and battle on both the Senate and House floors, the budget this year was wrapped up in a 2-hour, very quietly, low debated atmosphere. So you could tell that legislators were ready to pass the bill and get out of Tallahassee, because let's not forget, that was the time period when COVID was hitting, and even the Capitol was not immune from having a rather large scare, and the House chambers having to be disinfected because of potential exposure. So a few of the highlights that are specific to the 50 plus, the first one I want to talk about is affordable housing. This is an issue that has been ongoing for years, where the affordable housing funding has been swept by legislators for pet projects and other projects that are unrelated to our housing needs. Well, it's exciting because this year the affordable housing was fully funded for the first time in 13 years for a total of $370 million. So that's huge. Unfortunately, though, this is not an ongoing guarantee that it will be fully funded. There was legislation that would have guaranteed that the funds were safe and only available for affordable housing, but that legislation failed. So this is a one-year victory. If the governor doesn't veto this line item, affordable housing will have quite a bit of money this year. Another big chunk, and probably the largest chunk of our annual budget at the state, it goes to healthcare, whether it be Medicaid, health insurance, and any other kind of healthcare access services. So there's a few programs that are specific to the 50 plus that really had some great windfall increases. The first one is the statewide Medicaid managed care, long-term care pool of money. They saw an increase of $248 million this year. And, you know, if you don't know much about this program, it's the program that's designed to provide long-term care to those most in need, low income and disabled seniors and adults that need nursing home level of care. So to see a $248 million increase is fantastic. And hopefully that will be preserved in the budget when it's all said and done.
Mm-hmm.
Another huge program is the community care for the elderly, and it will receive a $4.2 million increase in funding. And this is something that provides home and community-based services for those most in need. So it helps impaired elders ages 60 plus remain in their home and get some of the most least restrictive and cost-effective services to keep them out of nursing facilities. So this is something that's really important to those of us that want to keep our loved ones at home. The Alzheimer's Disease Initiative received a $2.8 million increase. We all know if you have family or have had family that suffers from Alzheimer's, there's a lot of research that still needs to be done, and there's a lot of programs and needs, especially for the caregivers of people that are suffering from this disease. So the increase of 2.8 million is absolutely going to help provide some critical resources for those in need. And then finally, outside of the healthcare bucket, we have the public guardianship program. They actually received a $7.7 million increase. And to give you an idea, this is for those people who have no family, who have no financial ability to hire someone to look out for their best interest. And that's why it's the public guardianship program. And these funds will definitely be put forward to help those most in need as well. I got to remind everybody though, COVID hit. And unfortunately, a wrecking ball might be taken to this budget. While we have some great wins, once again, it's all going to depend on the red pen of Governor DeSantis.
So isn't it likely, though, that there would be a special session to address these budget needs?
Yeah, so there's a few different rumors floating around the rumor mill right now. Some people are pushing for a special session to address the budget. There are other people pushing for a special session to address the budget and other issues, such as Medicaid expansion, healthcare access, voting, a whole slew of other policy issues. And then there's quite a few people in the camp of we don't need a special session, and that with the federal funding and the additional dollars as a part of these congressional packages that will be flown to Florida, our state budget will remain solid. Governor DeSantis's angling on this and what he's kind of alluding to in media is that he doesn't believe a special session will be necessary and that he can just use his line item veto authority to rein in the budget where it needs to be reined in. So the best way I can answer it is we have no clue whether or not a special session will occur, but eventually we'll get something, right?
Right. So there definitely is much that's up in the air right now related to the budget, but I, for one, am super glad that you're watching closely for all of us. So now let's discuss some of those policy issues from the legislative session. And, you mentioned something about guardianship a minute ago, and certainly this is an issue that we hear a lot about, rightfully so. And I see that 2 guardianship bills passed. So how will they better protect these most at-risk Floridians?
Yeah, and that's a great point. So once again, for I think the 6th year in a row now, guardianship was a hot topic at the legislative session. And this year, a bill sponsored by Senator Passidomo and Representative Colleen Burton was in direct response to a pretty horrible story we heard out of Central Florida related to a guardian who had signed do not resuscitate orders on behalf of her ward, and it was against the wishes of his family and of the ward himself while he was alive. An investigation was conducted by the state of Florida, and come to find out, there were about 13 other cases where a do not resuscitate order had been filed, where people had passed away as a result of that. And so there was a real big churning at the media level and at the state level for legislators to do something to prevent this type of action and authority by a guardian over their ward. And so the bill that was filed and that passed does just that. So it requires that a court review a request by a guardian to file a do not resuscitate order. So they can't just go do it on their own. It takes court action to get it done now.
Mm-hmm.
In this investigation, it was also uncovered that there was a kind of a pay for play kickback scheme between the guardian and healthcare professionals. And so this legislation will now make it mandatory that if a guardian is seeking to get the authority over an individual, they have to disclose if there's a financial interest, if there's any type of money being transferred as a result of them becoming a guardian of a ward. It gives the court a little bit more authority to investigate any type of claims where there's a potential conflict of interest. And then finally, it also requires that guardians must have a cause to file a petition over a particular ward. The current status is you can just go file over anyone that you believe to have a lack of capacity. And now this legislation requires that there be a reason they're petitioning. So while this is a pretty significant piece of legislation, it really does seek to try to protect the interests of an individual. So this was a big win for people, and especially our most vulnerable. Mm-hmm. There was a second guardianship bill that was also filed that addresses a little bit different issue. So part of the guardianship system requires an annual filing by the guardian to give an update to the court of the mental health and physical well-being of the ward. Unfortunately, the courts are overwhelmed and there's a massive backlog of reports coming in, and there are doctors that are unable to get to these annual assessments of wards. And so there's just a big log jam. So some people are in guardianship situations that may not need to be in them anymore. And so the second bill that passed, and it was sponsored by Senator Bradley and Representative Fernandez-Barquin, seeks to lift that logjam by allowing advanced registered nurse practitioners to do the annual assessment. So a mental and physical evaluation, and then submit it to the court. It's a small piece. It's a important bill that hopefully will keep people out of unnecessary guardianship situations.
Okay. Yes, and I know that we all would hope that the governor would sign those bills as soon as they land on his desk, for sure. So now let's move on to an issue that we know is important to all of us, in particular folks who live out in rural areas. So the legislature passed a broadband bill, and tell us more about exactly what's included, and will it give rural residents better access to high-speed internet?
Yeah, and that's the goal of the legislation, is to connect our rural friends to more high-speed internet and telemedicine, tele-lawyering, like I like to call it, telepharmacy, anything that uses technology that we're kind of relying on these days. Right. A lot of people don't know that Florida has been very behind on broadband access statewide, and we've actually never had an office at the state level that focuses on drawing down federal grants. So free money for the state to start spending and spreading broadband access for its residents. Florida has been really good about providing this for businesses, but when we talk about communities, especially rural and residents, we've been neglectful on that as a state. So that's what this bill does, is it creates an office within a state agency that their primary focus is broadband internet, drawing down the free federal money, and then implementing that across the state. So it's going to create more jobs, it's going to create better access, it's going to help rural residents have lower cost internet services, and then it's going to better link all these small town doctors, lawyers, pharmacies to a high-speed internet that can actually help them do their jobs better. One of the things that we've seen, and I think this current pandemic has really highlighted, is the need for this. So, thankfully Florida passed this legislation, and now it just has to be signed so we can get this ball rolling.
Absolutely. And no doubt that we've all seen the necessity of having internet connectivity at all. Can't imagine not having it, but those broadband and the high speed, even more so with those of us working from home, or parents who have children also trying to learn at home, definitely big need. So sounds like Florida is now in a better position to receive those grants and provide that access to keep us, all of us, better connected. So
Right.
there was also a lot of news coverage about the long-term care wait list and nursing home staffing standards. But let's start first with the long-term care wait list. So can you give us a brief explanation about that?
Yeah, so this is a pretty complex issue. There were a lot of moving pieces. So I think we're right in breaking this down piece by piece. So for everybody out there, hold on to the seat of your pants because this is going to be a multi-level explanation. So first, the wait list. What is it? So the long-term care wait list is a list that the Department of Elder Affairs maintains, and it's for people who are seeking Medicaid services, but have to be prioritized to see what their level of need may be. Um, the goal of the long-term care wait list is to have those who are most in need be a top priority for the state to get those critical services to them, to keep them out of nursing homes and other critical care facilities. So think of it as a way to age at home, but with the healthcare resources that you need. When an individual is seeking these type of services, they have to undergo a screening, and it's basic information such as your general health, any daily assistance that may be needed, any type of activities of daily living that you would require assistance. And then based on this screening, they're given a priority score. That is where they are then put on the wait list. The lower your score, the longer you are possibly on the wait list to receive these services. And just as kind of a important note, this list grows every year. This is not a list. We're talking 70,000 plus on this list, Floridians
Wow.
seeking these services. It's easy to say a solution to fix this would be for the legislature to throw about 10 to 15 billion dollars and everybody would get off the wait list because they'd get the services they need, but that's just not a reality that we're going to see in our lifetime.
Well, it definitely would take a lot of money to fix with the waiting list that long. And you feel for people who are waiting or having to wait a long time. Can something be done to address that list? I mean, what is AARP advocating for to be done with this list?
Yeah, and you hear a lot of people talk about the wait list. The media covers it, legislators cover it, healthcare providers, nursing home providers cover it, both from the not-for-profit and for-profit sectors. And so the key is to be creative, right? Because we're not going to get the money that it would require to eliminate it. So one approach that AARP Florida took to address this was working with some of our partners. And this includes the Florida Healthcare Association, Leading Age Florida, Pinpoint Results, and SEIU, not always on the same side of issues, but we came together on this long-term care waitlist issue to form the Coalition for Silver Solutions. What we did in partnership with our other coalition partners was we held community meetings, we met with agency heads, we met with legislators, we met with private and public sector representatives from all sorts of industries that are related to long-term care health in Florida. And we sought to create some short-term solutions that we could recommend to the legislature as a group. We held a summit back in October in Orlando to talk about what we as a coalition discovered, what we were hearing from the community. A few legislators were present, and that's where we unrolled our kind of phase one, if you want to put it, our initial short-term recommendations. All these efforts in about a year's time culminated in legislation that was actually sponsored by Senator Albritton and Representative Webb that would require some modification on how people are prioritized on the wait list is done in Florida. So I'm going to highlight a few of the pieces of what this legislation did. Fortunately, it passed, and it took the lion's share of work from all of our coalition partners advocating in front of every committee, talking to every representative, having anybody in their membership call and press. We use the media as a mouthpiece. But here's what we were able to achieve. The legislation now allows individuals with a low priority score to be reevaluated annually. This was not previously allowed. It was much harder to get a reevaluation. An individual can now request a rescreening if their circumstances have changed. Think about how many people get screened and you're 3 years later, you still can't get rescreened, but your finances have changed, your health has changed. So now they can request it if circumstances have changed. And finally, the screening staff, so the frontline people who are on the phone talking to these individuals doing this screening, are
Mhm.
required to share local resources that are currently available in their area. It kind of seems like a no-brainer, but that wasn't required before.
Mm.
So you had people calling in that needed help, but were not getting any guidance the day of their phone call. So now that's all changed.
Okay.
So this certainly doesn't eliminate the wait list. It may not reduce a lot of numbers, but for individuals who are in need the most, hopefully this gets them a higher priority score so they can have access to these services that they need to stay
Mhm.
at home.
And thank you for that, because it does sound like those are very positive changes that'll help people get the help that they need. And now let's move on now. So the other thing we were going to talk about was the nursing home staffing standards issue. And I heard there was an attempt to get to gut those standards. So explain to us what happened.
Yeah, so this was a rather disappointing move by some in the industry and by some of our elected officials to gut the nursing home staffing standards that the state has set. Um, this would have no doubt lessened the quality of care that residents in nursing homes would receive.
Hmm.
It would have allowed non-nursing staff to provide eating assistance, medication assistance, and the nursing home would have been able to add that to the time that they're required to have compliance with staffing standards. So you have untrained individuals for those specific tasks counting toward nursing staffing time. It would have also allowed nursing homes to use certified nursing assistants in the nursing roles. So you have a workforce that is trained for a certain job, paid at a certain level, doing potential tasks that are outside of their pay base. So they get paid less to do what higher paid staff would be doing, and the nursing home counts that toward their minimum staffing standards. That's just not something that we were okay with. So we launched an all-out fight, and with some of our coalition partners as well, to advocate. We use the media to share stories about what residents could potentially face if this bill passed. Um, Thankfully, we were able to get the bill amended. And so the safety measures that we fought so hard to ensure that remained in nursing homes were in the final bill when it passed. Now, once again, this is waiting for Governor DeSantis, and hopefully it's something that would be signed.
Well, yes, we do hope so. But you mentioned train bill. So help us understand what that is. How does that come about?
Yeah, so the staffing standards bill did become part of a train bill, and this is a fun little practice of the legislature where each side, the Senate and the House, identify the priority issues of leadership. And once those issues are identified, those are the ones that are pretty much guaranteed to pass. And so that becomes the catalyst or the engine for the train that is created. So this year it was scope of practice was a priority issue for Speaker Oliva in the House. He wanted to make sure that passed. So that pretty much guarantees that he will do anything to get that across the finish line into the governor's desk. What we saw was our direct care bill amended onto the scope of practice bill. Um, this is nothing new. A lot of times train bills consist of major issues like education, criminal
Mhm.
justice, and healthcare. So this is just one way in which legislators get a bill passed that may not pass on its own merit. They add it on to the priority of the leadership to guarantee its passage.
Okay, I see. So it's safe to think of it this way, that the train bill is a group of individual bills that then merge together and they become one large bill. So this is what happened to the nursing home staffing standards bill, right?
Yeah, this is exactly what happened. To give you the idea, so an issue that we supported was this scope of practice, allowing advanced registered nurse practitioners to practice in their field without the supervision of a physician. The bill as filed was 13 pages long,
Wow.
very short, very simple bill. At one point during the session, so many other bills were amended on to this 13-page bill, it ballooned to 158 pages. So
Wow.
you no longer just have a single issue, you have multiple issues related to healthcare on this
Mhm.
now train bill.
Mhm.
When it was all said and done, what passed was a 70-page bill, which included our direct care or our nursing home staffing standard bill. Basically, in order for the nursing home staffing standard bill to stay alive, it had to be attached to the scope of practice bill. it would have died, or legislative speak for never coming back, right? It's done for
Mhm.
this session. If it was not attached to that scope of practice bill, then it would have never passed. So that's the essence of a train bill. You get issues passed that would have died otherwise.
So very interesting. And some things are just not so simple. So thank you for letting us know about that. And sticking with healthcare, since we've been talking about that, what about the assisted living facility oversight? So I heard AARP played a pivotal role in fighting potentially damaging change related to adverse incidents. So tell us more about that.
Yeah, and this is something that we like to call a defensive win. So a bill was filed that would have changed the rules related to reporting adverse incidents in assisted living facilities. Current law said that you get 1 day for if something bad happens in your facility. The ALF, the assisted living facility, would have to report it within 1 day to the state agencies that oversee them. The bill, when filed, changed that 1 day requirement to give them 15 days to report an adverse incident. Now, you and I know, and anybody that really thinks about it would know that 15 days is quite a large window for continued harm,
Hmm.
for additional adverse or bad incidents to occur, and that at times can mean the difference between life and death.
Of
So
course.
one thing we did was advocate for the bill to be changed back to 1 day. We were successful, and obviously, thankfully, legislators saw that 1 day, one business day technically, was more than enough time to report an adverse incident, and they kept it at 1 day as opposed to 15.
Yeah, I mean, it stands to reason, right? Adverse incidents should be reported right away. So thank goodness that the legislators agreed on that. And in addition, I know that AARP supported the genetic information for insurance purposes legislation. So is this related to those 23andMe type tests that I took and my family took? So tell us, how is that information being used, and what did this legislation do to it? Because I know many of us have done those tests.
Yeah, I'm an ancestry DNA person.
I'm a
Um,
both.
so yeah, and ironically, this is the dirty little secret that the long-term care and life insurance industries don't want people to know. Um, 23andMe and Ancestry DNA, when you take their test, if you don't read the fine print and mark a box that says you do not wish to have your genetic information shared, buy the information. So the long-term care industry, insurance industry, can buy your genetic information from Ancestry or from 23andMe or from other genetic testing resources, and then charge you higher premiums. So say, for instance, Ingrid, if you took a 23andMe and your DNA marker shows that you have a high propensity for a certain type of cancer, well,
Mhm.
if you want to go get a life insurance policy or a long-term care policy, they can actually charge you more if they know of this genetic marker, whether or not you develop the cancer or not.
Wow.
Um, yeah, it's pretty disturbing. But interestingly enough, the federal government has remained silent on this. The only thing our federal government has said is that health insurers may not use genetic DNA to charge more for health insurance policies. So Florida is the true leader on this issue. We are the only state to address life insurance policies and long-term care insurance policies and preventing them from using our genetic markers to charge more. This is absolutely a huge consumer win, and something that many other states are probably going to follow Florida's lead on, because we are paying more for things that we cannot control in these
Hmm.
situations.
No, and that is great news because, as we both said, so many people have taken these tests, and then it also speaks to why we should like take our time and look at all of the fine print, and anything that is optional, understand what we're saying yes or no to fully. So now let's move on to prescription drugs, the topic that we love to hate. Or that we fight on because it's necessary, but certainly AARP has been fighting for against prescription greed with the prices. So last year, AARP supported legislation that became law, called for the importation of safe prescription medications. So can you give us an update on that? And was anything done this past session? Was there any new news that will help make it a reality for us to start saving money on these prescription medications anytime soon?
Sure. So we all know prescription drug prices can be rather high and hefty, and
Yes.
that pharma is able to set a lot of prices at a certain point. And one of the things that we've fought nationwide and here in Florida very hard on is to ensure that low cost prescription drugs are available for all Floridians. And one way we did that was during the 2019 legislative session, we fought for a bill that allowed for the importation from Canada and other countries for commonly prescribed drugs, so that way pharmacies could sell them at a lower price. That way the state could obtain them at a lower price for Medicaid patients, for state prisons, for disability homes and other facilities, saving Floridians money across the board. But this wasn't a one-step process. So while the legislation passed
Mm-hmm.
in 2019, there's about 5 other hoops we needed to jump through to make this a reality, and we're certainly closer. So one thing the state of Florida did accomplish was in August of last year, we submitted our plan to the Health and Human Services and the FDA for approval. As a result of Florida's submitted plan, the FDA opened up rulemaking at the federal level to decide how states could safely import prescription drugs. They used our plan as a blueprint for the federal standards now. In December of 2019, Governor DeSantis, Secretary Azar, some of the people that you've been seeing on daily briefings at the federal level, came to Florida to announce that we were moving forward on the importation plan.
Mm-hmm.
During the legislative session, our legislature, to complete a third hoop, allocated $10 million annually for the administration of the plan in Florida. So we're getting close, right? We had 5 hoops, we're through number 3.
Mm-hmm.
Number 4 is now before us. We are having to wait on federal authorities for final approval of Florida's plan. So we've been able to prove how we will save money. We've been able to prove that we will, as a state, put money forward to help pay for this program. And now the feds have to approve our plan. Once the feds approve our plan, we then go back before the legislature for a final approval. According to the Agency for Healthcare Administration Secretary Mayhew, she expects that we'll be able to start importing prescription drugs by mid-2021. So hopefully the feds do their job so we can finish it here in Florida and start bringing in lower cost prescription drugs.
Great. So once again, Florida was the leader in the fight by states to provide low-cost prescriptions. So that's awesome news. And I also saw news that Florida is paving the way in a different way for residents to access prescription drugs in a whole new way. And this one sounds really interesting. So explain to us about the prescription medication ATMs that I read about. This sounds very cool.
It is. And this was actually one of my favorite bills. So this is 5 years in the making. For those of you that don't involve yourselves in legislation, I always like to say the wheels of justice turn very slowly. So typically legislative ideas and battles aren't a 1 year and accomplished. This is the perfect example of 5 years in the making finally happened. What Ingrid's talking about with these prescription drug ATM machines is that there will be kiosks similar to an ATM or a red box, where you get a prescription from your doctor, you go to the kiosk, you feed it into the machine. On a television screen or on a screen, a live pharmacist pops up to talk to you about your prescription. It's very similar or no different than what we see at a pharmacy when they ask you, do you have any questions? They discuss any potential drug interactions that you need to be aware of. As they're doing this, the machine is filling your prescription. Once the pharmacist has finished their discussion with you, the machine dispenses your prescription and you walk away. This is a really good tool to use for people to have access to prescription drugs in rural areas who may not be able to get to the pharmacy before it closes. People who get, healthcare services and they're discharged and it's too late to make it to the pharmacy, they can now go to these kiosks to get their prescriptions. Now, it's important to note that this is not every prescription drug. There's no insulin in these machines. There will not be any of the narcotics or any drugs that require compounding. Those types of prescriptions, you'll still have to go see a live pharmacist in a store. But this is, once again, a way that a lot of individuals will have access to prescription drugs that would not have it otherwise.
Right. No, thanks for that explanation. And it makes sense that those couple that you mentioned wouldn't be that readily available. So now looking at the calendar, May is almost over, summer's almost here. And well, here in Florida, I don't know, how do we tell? But anyway, it's hot. And so our bills go even higher than normal, where we're trying to get cool and keep our homes cool. So I know that some companies reduced bills during the COVID pandemic, or at least in the early parts. We were hearing about some relief available, but it might not happen again for a while. So talk to us about what's on the horizon regarding your favorite topic, utilities.
Yeah, and anybody that knows me knows I love to talk about utilities. So I'll start off and say, thankfully, we didn't see any type of utility legislation that would have negatively impacted consumers during the 2020 legislative session. But with that being said, I do want to give a few updates. Like Ingrid, like you mentioned, our monthly power bills for most power utility companies in Florida were reduced significantly for the month of May. That's great to see, but I just want to remind everybody that that is something they're legally required to do. When the demand for energy drops, so do the prices that our utility companies pay to bring in energy. Therefore, they are legally required to refund that to customers. Now, what is traditionally done is that savings is spread over a period of months, from 6 months to a year. So the big favor that the utility companies did was made it all at one time. So for the month of May. I want to make sure people know that most likely your bills will be right back up to their normal level on your June bill. So this was a one-time kind of savings, but thankful obviously that this was returned at a really critical time when a lot of people were out of work or financially strapped at levels we haven't seen before. A few other things that are on the horizon as it relates to utilities. If you are in Florida Power and Light territory or Gulf Power territory, they're going to have a rate case next year. Every 4 to 5 years, there's a rate case, and the utilities get to go to the Public Service Commission and request to charge consumers more on their monthly power bill. We anticipate a pretty significant request in raising your rates for a few different reasons, the least of which is a result of legislation that passed last year that allows the utility companies to charge you, the consumer, for undergrounding power lines. FPL, Florida Power and Light, has come out and said that over a 10-year period, this project's going to cost about $50 billion. That's with a B, billion. That will all be paid by consumers. If you pay a power bill, you're going to pay part of this $50 billion. The way they make that happen is they add it onto your bill in the form of higher rates. If there's a hurricane this year, obviously we will have to pay for any type of damages that happen to the system. They're legally entitled to request this, and that's fine. One of the things we act as is a watchdog to ensure that they're not asking for too much and that they're able to justify the amounts they're looking for. This will all come out in 2021. Now, for those of you in Duke Energy or Tampa Electric territory, you don't get to escape this pain either, because your rate case is going to be in 2022. Florida, AARP Florida is one of the few consumer advocacy groups that advocates on utility issues when it comes to the financial impact of consumers. We anticipate to be front and center during these rate cases to really fight to keep your rates low, but that also includes the need for you to be a part of the conversation and the advocacy to keep your bills lower as well. So we'll definitely be coming to you in 2021 and 2022 with a lot more information.
Well, we'll be ready, because you need to let us know when you need our help, and we jump in, because we all know that the utility industry, of course, is extremely powerful. They spend a lot of money, whether it's political parties or candidates and special offices, which we don't do. So it's good to know that at AARP we have this community, members, consumers, volunteers, staff, everybody, and we'll work together, try to keep our monthly bills low. But another scary thing you mentioned, hurricane disaster preparation. It's a reality for us, as we enter May and of course June. So I do know that a pet related hurricane evacuation bill passed, and as a pet owner, this was important. So, but I thought that it was already a law, because I'm not going anywhere without my dog. So elaborate on this for us, because we want to have good news for those of us with pets.
Sure, and this is a great example of one of those feel-good bills that had bipartisan support that I don't think anybody opposed, and rightfully so. But like you alluded to, it wasn't required that every county provide a shelter in an evacuation situation that could take pets. And so
Mhm.
we saw a lot of stories. Think of Irma, think of Michael, where people didn't evacuate to a safer area because they couldn't take their pet with them. So that's the idea behind this bill that passed, that's still waiting Governor DeSantis' signature. It now requires that every county provide a shelter that can take in pets. And so this is really good for anybody that's a pet owner. And it's not just dogs and cats. It can be other pets. I don't know that it's means bovine or horses, but any type of house pet, these shelters will be able to take in now.
That is great news for us pet lovers. So thank you so much, Zane. The in-depth coverage that you provide, that you keep in your head, that you track on a day-to-day basis is amazing, and we thank you for it. So now, if you're up for it, we can turn it over to the audience. I know Patty has been keeping track of some questions for you. So good to go?
Yeah, let's do it.
All right, this is from Timothy Dutton. He submitted this through our form, which was, how is equity reflected as a priority in the work you're doing in Tallahassee?
Good question. So I think at AARP, both here in Florida and nationwide, we always seek to make sure equitable solutions are found on every level, whether we're talking about discrimination on issues such as age, disability, racial, gender, LGBT. That's something that AARP takes very seriously. When we talk about finances, that is the viewpoint AARP most often takes when we take on legislative issues, is how is this impacting the consumer? How does this financially impact a family, a caregiver, an individual? So we often use consumer viewpoints. And like I mentioned with utilities, we're one of the few, there's about 2 other organizations that actually represent the consumer voice in utility issues. We're talking about hundreds of millions of dollars of cost to consumers that we're battling every year to try to keep in your wallet and not the shareholders' wallets of utility companies. So equity is a primary focus that we have on multiple levels when we're before the legislative body.
This one was from Phil. It says, was legislation on the Sadowski Fund, so affordable housing, provide full monies for 2020 only, or is it protected for the future? That's key.
Yeah, and Phil, unfortunately, the bill that would have protected the full funding moving forward failed. So this year's full allocation is just for this year. It is not guaranteed for future years. Obviously, it's something that AARP, along with our about 50 other organizations through the Sadowski Coalition, will continue to fight for, to ensure that these critical affordable housing funds are guaranteed for housing and not other projects moving forward.
Larry asked a question that says, how does the new legislation, did not refer to what new legislation, protect people in nursing homes during hurricanes? And I know this is the subject of a whole new webinar, but if you can quickly answer this one for Larry.
Yeah, so there wasn't new legislation this year that addressed specifically in an emergency situation such as a hurricane, what would happen to nursing home residents. I think if I'm reading the tea leaves correctly on the basis of the question, it's more of a result of what we saw after Hurricane Irma in Hollywood Hills, where residents died because of overheating. The state reacted through issuing an emergency rule that required nursing home and assisted living facilities to have a backup generator or some sort of emergency plan in place. So if the power goes down for an extended period, we can ensure that the residents stay cool. The unfortunate side and the answer that I have to give is that not all facilities are in compliance and still are not in compliance today. What COVID-19 actually exposed is a greater number of facilities requesting waivers to remain out of compliance. Now, are there some legitimate concerns they're raising as a result of the COVID pandemic and why they can't be in compliance? Yes, but that should not preclude them from having to have a plan and what to do if the power goes down and the temperatures start to rise in their facilities. And that is something that AARP will continue to be a strong advocate advocate for, is ensuring that there are plans and that compliance on a certain level takes place.
Okay, and this is from Linda. It says, can you tell us how many people the 4.2 million increase in CCE will help, and how many people that will likely still leave on the waiting list?
Linda, that's a great question. I don't have the numbers in front of me, so I definitely don't want to throw anything out that is misleading or not correct. Obviously, the wait list for CCE will remain high. I think we saw this increase will help maybe a few hundred at most, 200 to 300 people on the wait list. Obviously not enough, and the state could and should do more, but we also are excited that there was an increase. It's better than the opposite, where there was a decrease in the annual funding. But I will follow up with you on direct exact numbers.
That's it for our questions. If anybody has any more, you got a couple seconds to get them in the chat session. Otherwise, I'm going to hand it back to Ingrid.
All right, well, thank you so much, Patty, for taking care of the questions for us today. I want to thank Zane again for the great insight and all the knowledge and all the hard work that she does for all of us. So thank you, Zane. And to our attendees, I say be sure to join us next week, Wednesday, May 27th, noon Eastern time, same channel, when Zane and I will give you the update about the federal legislation and the latest news coming from Washington, D.C. Thank you again, everyone, for being here. I remind you all about keeping physical distance to stay safe, wash your hands, and that concludes our program for today. Thanks again.
Thank you.